I'm Louis Scamardella. I'm the Regional Director of the Lower Hudson Valley Small Business Development Center. And thank you for joining our workshop on how to open up a child care business. Before we begin, I have to thank our host, St. Thomas Aquinas College, for providing the facilities to make this happen, and also to Senator Schumer, who provided the support for us to get a grant, a portability grant, to make this event possible. This course has been designed to take your passion, your skills, and your love of children and to help you open up a business. Every attempt and every working moment has been made to make this a quality course that delivers value to you. You're going to hear from many experts today, but I want to emphasize the most important person in this course is you. Your engagement, your follow-up, you becoming a client of the SBDC to make your dreams of opening up a child care center or a child care family home a reality. Now, I would like to introduce our first presenter, Kathy Morse. She is a member of Quality Stars of New York, and she has held various positions in the field of childhood education and has more than 20 years experience in various capacities. Kathy?
Good morning. Thank you so much for being here. I am delighted to be here both virtually and present here on site at STAC. I am a graduate of STAC, so it is a little bit of coming home as well. So I do welcome questions throughout the presentation. If you are on the Zoom, please feel free to enter it in the chat. And if it's something that you need clarification around, I'm happy to sort of go through it and see and flesh that out for you a little bit. Certainly, if you're here live in the audience, I certainly welcome them at any point in time as well. I have been in the field of early childhood education for over 35 years. As I said, I started with my bachelor's degree here at STAC and got my master's degree at Iona College, so still keeping it local to the downstate New York area. And I have worked with all sorts of different types of childcare program, whether it be a family or a group family provider who's doing it in their home, or a center who is providing children care for children in a specific building, as well as public schools who are serving children in a preschool setting, 3s and 4s. All of that we will sort of get into today. What we will not really get into today is school age care. And so I'll speak about it briefly at different times, but that's really not the primary focus of our session today. So if you have questions about that, please feel free to put them in the chat and we'll try and follow up with some resources afterwards. Or you can certainly ask questions, as I said. I also want to explain we are not getting into the requirements and the expectations or the licensing requirements for New York City. The New York City childcare is licensed through the Department of Health and Mental Hygiene in New York City. And we will not be speaking about that today. So we really are concentrating our conversation on outside of New York City and what we call the rest of the state, which is licensed by the Office of Children and Family Services, OCFS. You'll hear me refer to that quite a bit throughout the presentation today. So I just want to put that out there as well. So we will be going through quite a few pieces today. I'm basically going to take you all through the information up to number 5. Then we'll have both Lydia and I think Nicole is going to be speaking. So again, please feel free to ask questions throughout the session if you'd like. These are the objectives today. We are going to be giving you sort of a high-level overview about different aspects to consider and think about when opening a child care program. This is not a deep dive into OCFS licensing requirements. I want to be very, very clear about that. We will certainly reference them throughout the session, especially in the very sort of immediate next few slides. But we are not taking a deep dive into every single one of the expectations that you have if you're opening up a child care program. So we're just trying to give you a high-level overview of different aspects to consider and to think about as you're opening up a child care program, and many of those we'll talk about today. So let's get right into it and talk about a bit of the differences between the different types of childcare programs that are out there. So family childcare is different than group family childcare. And then we also have center-based and school-age care. So I will break this down and we will go into these each a bit more specifically. So, family childcare is an individual who wants to bring children into their own physical home that they are then caring for throughout the course of the day. It can include your own child, if you have children, in that ratio number of the number of children that are allowed from that one, what we call provider, to the number of children that they're allowed to serve. As a family childcare program, it is only that one person, that provider, who is providing care to those children. And so the number of children is relatively limited. It's the max of 6 young children. But they can, as I said, have their own child count in that or towards that teacher-child ratio in their home environment. In a home environment, as I said, there are no other staff members. It is solely you providing care. Just because you are licensed to provide care to 6 children potentially does not mean that you are required to take in all of those 6 children either. So you do have a little bit of flexibility in terms of the number of children you're serving. You also have a little bit of flexibility in determining the ages of the children you want to serve. If you only want to serve 3 and 4-year-olds, that's totally fine. If you only want to serve infants and toddlers, that's totally fine. If you want to serve a mix of all of the ages of the children in your program, totally fine as well. So as a family child care provider, you have that opportunity to determine how many children you want to serve and the ages of the children you want to serve. Now, I want to also further elaborate that licensing requirements will not allow you to serve 6 infants and toddlers all together at one time. That would just be way too much for one person to humanly care for. And so you are limited, depending upon the ages of the children you serve, how many of that age group you are able to serve. So typically speaking, they will only allow you to serve 2 children under 2 for every 1 adult. Okay, so kind of makes sense. I always say if you think about a fire, you can grab 2 babies and get out of the building. You can't grab 4 babies and get out of the building or out of the home. So it is, again, something to think about as you're planning to open your childcare program. You really need to give some consideration to the number of children you're looking to serve and the ages of the children that you're looking to serve, because that's definitely going to make a difference. As I said, you can serve mixed ages, and in a family child care home, you can also serve, let's say, preschool children during the day, and then after school, you can serve after school age or school age children in your home environment as well. So that's totally allowable. Now, group family is pretty much almost the same exact model as a family child care home. The difference here is that it would be yourself as the provider, and you have additional staff that are hired to also work in that child care program. So here, the ratios go up because the staff members go up. So here you're able to take a few more children, depending upon, again, the ages of the children. That rule of 2 children under 2 years of age to 1 adult still applies in group family care. But again, you have the distinction of determining how many children and the ages of the children that you want to serve. You then become an employer. So think about that, and managing another staff member and communicating to the other staff. That's also one of the distinctions of moving into a group family setting versus just being a standalone family childcare program where it's just you as that family childcare provider. You can serve mixed ages of children. And again, you can also have after school children come to your group family childcare program as well. Okay. Then a child care center is a completely and totally different ballgame. And so a child care center is a physical brick and mortar building that you're identifying in whatever geographic location you would like. It is a facility that specifically is designed to house and care for children for a significant portion of the day. Anything over 3 hours of care requires a license, a childcare license. If you are looking to develop what I'm going to say is sort of a mommy and me type of a program where families and children come together for maybe a 2-hour period in a group setting, that is not required to have a childcare license, and that would not be considered a childcare center. So a childcare center is physically located out of your home, another specific distinction between family and group family and a childcare center. So here in a childcare center, the children are not mixed in the same way that they would be mixed in ages in a family or group family home. Here in a childcare center, the ages of the children are all grouped together. So you would have an infant room, a toddler room, a preschooler room. The 3s and the 4s of preschoolers could be mixed. They don't have to be only 3s and only 4s. But the ages of the children would be a separate room in that building. And again, you could also determine we only want to serve preschooler children. We only want to serve infants and toddlers. The ages of the children is your discretion as you're developing and thinking about the type of program that you want to open. I would also, and we'll get to it in a little bit later, but I would also encourage you to sort of survey the community that you're thinking about opening your childcare program in. And if it is with preschool care, opening up another program, unless you have a specific need for another program in that area because there's such a significant need, and the children exist and they're there, I would say think about opening another program that's not necessarily meeting one of those targeted areas, and you may have better receptivity. So in a childcare center, you could be the owner, you could be the on-site director, you could do all that. But again, you have to remember that you are also then becoming an employer, and you are hiring staff to cover everything and to do all of the work within that program. And I will say that also includes answering the phones, sending out the emails, registering families, taking out the garbage, cooking the meals if you're doing that. So you really have to think about the true investment in the program, not just in the classrooms with the children. So we'll get now into the licensing requirements. As I said earlier, we will speak specifically about New York State and not New York City. So New York State is regulated, has regulated childcare through the Office of Children and Family Services. OCFS is what you'll hear me refer to it from now on. As I said earlier, in New York City, it is the Department of Health and Mental Hygiene. So that's not to say that anybody who's here or watching now live or watching a recording certainly could go to the New York City website and find the Department of Health and Mental Hygiene's requirements for opening a childcare program. They are public, it's public-facing information, so it's very easy for you to find, but we will not be addressing it here. So OCFS has different sets of regulations based on the type of childcare that you're providing. So family, group family, and then they also have centers. They also have a set of regulations for small programs, which we're not going to spend a lot of time looking at today, but they are also available on the OCFS website. I will also say this, I'm not going to be clicking out of the presentation to get out to websites or anything like that. It's a bit too choppy. However, following the presentation, you will be getting an email with I believe the video recording of the session, but you'll also get a copy of all of the links that I'm now referring to throughout the session in one document to make it super helpful and an easy resource for you to access at any time. So just be patient. We will definitely get you the information, but we're not getting it to you right this moment. So OCFS has regulations literally right on the front page of their website. You can go there and get that. I will also say on the OCFS website, start to look at it, start to become familiar with it. It does have a wealth of information there for you. They also have a link and some resources regarding starting a child care program. So I would strongly encourage you to check that website out and to start to take a deeper dive through some of the resources that are there. It will help you sort of become familiar with some of the OCFS expectations and the requirements that you're going to need to meet as you're becoming a child care provider in your home or at a child care center. One of the first things, if you actually continue down this pathway is to create an account in what they call FAMS, FAMS, which stands for the Facility Application and Management System. It is sort of the data management system for OCFS, and that's where all of the information regarding your license would be kept. Every one of your inspections is put in that. Every one of the requirements, for lack of a better word, that you would need to complete in order to obtain your license, it's all housed in your FAMS account. So some of you that may be a little bit further down the road, you already may have a FAMS account. Some of you may not be familiar with it at all, so there's some new information for you. But that would be where you would start your initial application, and that would track all of your progress until you actually obtain your certification, your license. And even once you obtain your license, you're still going to need FAMS because, as I said, there are staff members potentially that are involved. You would still need to go through clearances and background checks, those kinds of things. That's all taken care of within the FAMS system. Another great resource for you, and I think one that many programs and many people out in the community don't necessarily know about, is your local Child Care Resource and Referral Center. That was the terminology that we have had and we have used for probably about the last 35 years. We're now changing that terminology to be the Child Care Resource Center. Every county across New York State, and I am going to say even including New York City, does have a Child Care Resource Center. In it, New York City has multiples, but across the state, pretty much they are all county-wide. And the sort of oversight body that supports the Child Care Resource Centers is known as the Early Care and Learning Council. And so there are 35 different resource centers across the state. They are specifically designed to support anything and everything early childhood related. And so supporting you in getting more familiar with licensing, getting to know different expectations or requirement, potentially knowing what's available in that particular county in terms of grants and or other resources, that's a really great resource for anybody opening up a child care program. So when you get the links, there will be the link to the ECLC, which is the Early Care and Learning Council. You'll be able to see every one of the child care resource centers located across New York State. And there will be 3 specifically for Rockland County, Dutchess and Putnam, and Westchester County. And so those 3 links will take you directly to those the different resource centers that are there. They are slightly named different things. They're not all the same. And so Child Care Resources of Rockland is the Child Care Resource Center that's here. Child Care Council of Dutchess and Putnam, and then the Care Council of Westchester. Those would be the Child Care Resource Centers that are located within our current geographic location. Just to go back to that also, they do have staff members who can support you and sort of walk you through opening a child care program and also be a resource for you. If you are a family child care only, you will be registered, and you will be registered through a registrant at the local child care resource center. So they are part of the OCFS team. They just are housed at the resource centers. If you are a group family or a child care center, you will have a regulator who is housed at through one of the OCFS regional offices. And so the resource centers also play a role even in child care licensing, so that they are really trying to get those staff members closer to the ground where the child care programs are taking place. So staying on the licensing train, there are some additional licensing requirements that you would need to meet in terms of more than just what's happening in the child care program. In order to get a child care program up and operational, you might need to do a few things. So first, we're going to take a little bit at look at zoning. I'm going to say specifically for family and group family providers. And I am asking the question, it's a rhetorical question. Do you own the home or do you rent the home? And that's going to make a difference. If you are renting a home, you need to make sure that your landlord is going to approve you running a business in your home. And the landlord may say, no, I don't want you to. And so you would not be able to obtain a child care license to provide child care in your home unless that landlord obviously gives you authorization. Obviously, if you own your own home, totally fine. You need to also look at local zoning requirements. Is that area zoned for business? Even if it's not, you as a family child care provider are able to run a business through your home. And it is a bit of a distinct sort of business model. And I would also say if you run into any problems with that, definitely reach out to the group here at the Small Business Development Center, and they can sort of try and help navigate with some additional resources that we'll provide to them. If you are a center, obviously, as I said before, that is a facility located outside your home environment. You're going to need to find out if that area is zoned for a business. Because again, remember, a child care center is a brick and mortar building. You cannot just smack a brick and mortar building for business in the middle of a residential space. And so you need to make sure that if you are thinking of establishing a center, a building for business, it's zoned for that, for the child care program, okay? The Office of Buildings, Zoning, Planning, Administration, and Enforcement in your local city, town, community would probably be a really great resource for you to look at and to think about. Again, if you're considering it and you have a sort of a building and a location in mind, you may already know it's a storefront, it's that type of a building. We already know that that's obviously zoned for business. It's for some of those locations that you may want to take over a home, renovate it, and make it a center. It's those kinds of places that you would need zoning requirements or meeting zoning regulations in order to have that happen. And that's really something you want to think about early in the process, because I wouldn't want you to start to go down that road and invest your time and potentially resources, and then it doesn't end up working out. So that's really something to think about as you are thinking about the type of program that you're going to be opening. There will be a few different what we call pre-inspections from OCFS. Staff members from OCFS, again, the Office of Children and Family Services, again, they are located across New York State. There are I think 10 different regional offices that they have. Somebody from that regional office, obviously regional to you and where your business will be, will come out and do a pre-inspection of your site, specifically if you're looking for a child care center. They will review the space. They will point out different things that may need to be amended before they would be officially able to license them. That is not your licensing walkthrough. I want to be very, very clear and make that distinction. They're giving you sort of a courtesy pre-inspection to give you a heads up to say, yes, this would be licensable space if you did this, 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 and this, okay? Also, OCFS does have a few checklists on their website that are super helpful. They are also specific to family, group family, or centers. So pick the one that's applicable to you. And again, those checklists will be in the email that you get after the session. OCFS also has a fire inspector who can also come out and will do a fire inspection for your program. If and when that happens, I would highly encourage you to follow whatever guidance and recommendations they're making. If they are not completed, you will not go any further in the OCFS licensing process. So whatever recommendations they are making for you, please make sure that you follow those, because we want to make sure that that actually brings the license to completion and you're in the right path to get that done. And then there are potentially a water testing requirement, because it depends upon if you have well water or not. If you have well water, and if your program is a home, group family home, or a child care center, you would need, and you have well water, you would need to have the well water tested and submit that documentation to OCFS in order for the license to be finalized. If you are tapping into your local town, city water, whatever it is, that the water testing requirement does not apply. There's also information on the OCFS website regarding that as well, and some helpful information there. That link will also be included. So that's kind of part of the licensing requirements. Another large part of the licensing requirements is training. OCFS has a significant amount of training requirements as you're getting up and operational. They definitely want you to have some minimal health and safety requirements and understand a little bit about basic needs that children have as you're opening up your childcare program. They also have want to make sure that somebody is certified in CPR. And I want to say certified in CPR and first aid all the time. So if I am there and I am trained in CPR and first aid and I only work from 8 to 4, but your program is open until 7 o'clock at night, you need to make sure that somebody is going to be there from 4 till 7 o'clock at night that's there who's also CPR and first aid certified. You also need to have a provision if I call out sick. Right? So having multiple people trained in these types of things is only going to be a benefit for you, and it helps to manage and sort of mitigate the amount of time you're having to shuffle people and move people around based on only 1 or 2 people have CPR and first aid training. There are also several ongoing training. So OCFS has a requirement that they want 30 hours of training in a 2-year licensing cycle period. So basically 15 hours each year, yourself as the on-site trainer, teacher, provider, or program director. Anybody who's working in and for that childcare program needs to have that licensing, the training requirements met. And so those training, the ongoing training is something that we'll speak about in a quick second. These are the 10 OCFS training areas. And what OCFS wants really is a diversified training sort of portfolio, for lack of a better word. They don't want you just getting all your training on principles of early childhood development. Great topic. You should all take some courses and learn some information about that, especially if you don't have that background coming into the field. We want you to have a sense and an understanding of who young children are and what they need and how they learn and develop. But we don't want you spending all of your time in that topical area. So they have broken out 10 specific training areas. I'm not going to do a significantly deep dive into each one of them, but those 10 areas should be sort of addressed within your 2-year licensing cycle. So helping also if you are managing staff, helping to manage the training that staff members have is also going to be one of your responsibilities. And helping to sort of diversify the training that they're getting is also part of your responsibility as the manager of that particular program. Okay. So principles of early childhood development, nutrition and health of infants especially is a really good important topic, especially if you're going to be caring for infants. Child daycare program development, understanding the ins and outs of childcare program and how to run an effective program. Safety and security, we cannot get enough of that. Health and safety is a primary focus of what we do in early childhood education. So making sure you have lots of training around that is always a good thing. Business and maintenance and management, record maintenance and management. There is a lot of documentation that you need to develop as you are thinking about opening a childcare program. And we're going to get into that a little bit today. So that's a really important thing. I'm going to also say thinking about an electronic platform. We'll speak about that. But these are all things that you want to start to consider as you're thinking about opening that childcare program. Abuse and maltreatment, certainly regulations that are pertaining to childcare. I will say a great resource for that is back at your local childcare resource centers. Statutes and regulations pertaining to child abuse and neglect and maltreatment. Shaken baby syndrome and ACEs. ACEs is the Adverse Childhood Experiences Survey. It's basically looking at markers of, I'm going to say stress or an adverse experience that can have ramifications in not only the child's growth and development, but can have lifelong implications. And so that's a relatively new topic for OCFS, but a great one that people should also be familiar with. I know that there was a question in the chat box that there's a staff member or a person from a school age program who is in Aspire, and can they join Quality Stars New York? And the answer to that is not yet, not right yet. The Quality Stars New York will be launching most likely towards the end of 2026 school age standards. So More to come, and stay tuned on that. But as of right now, no, that's not accessible. Quality Stars New York is only supporting programs birth through 5 currently. And like I said, more to come on the school age. So, okay. So I'm just going to start again. So sorry for you if it's a repeat, but getting into the training standards. So Aspire Registry, you create your own individual profile. You create that with your education, your professional development, and your experience in early childhood. It is a database sort of network around the early childhood workforce. And so anything related to early childhood would be what they're looking for. If you're coming into early childhood now for the very first time, welcome. We're happy to have you. But that's totally fine to still put your other degrees and things like that in there. And then as you continue to build your knowledge around early childhood, you would just continue to put that into your Aspire profile. The other part of Aspire is if you're opening a program, even if you are a family childcare, group family childcare, or if you're opening a childcare center, you can also create with your license, once you obtain it, an organizational account in Aspire, which would basically house all of the employees who have their individual profiles. And so that's, again, a great way for your licensor, your regulator, to see the professional development opportunities that your staff members have had. There's actually a report that gets generated in Aspire that shows every one of the staff members, how many hours they've had, and the different number of hours of training in total that they've had, again, to make sure that you're in compliance with the training standard that OCFS has set. The other sort of part of Aspire, the other hat they wear, is the quality assurance entity for all of New York State to ensure that the professional development opportunities that are out there for individual staff members meets the expectation that they're high quality trainings that the staff members are obtaining. And so they do have a quality assurance entity. For those of you that are attending the session either virtually or live here in person, you will be getting an Aspire certificate showing that this has been a quality assured course. And so that's a great thing to scan and upload into your Aspire profile whenever you get that done. There's also on the New York Works for Children website, again, I promise the links will be sent to you following the workshop. There's also what's known as the PD Finder, the Professional Development Finder, and that's an opportunity for you to go to the Aspire website. You can do a few things. You can just literally start scrolling day by day by day. I've got Friday free. What's available? Take the course. Or you could say, oh, I need OCFS Area 5. I don't have any trainings on that area. Let me see what Aspire has. And you can filter it by different course topics. You could also put in the search bar environments, child development, behavior management. The list literally goes on and on. And so the PD Finder can help you find trainings, again, live and in person or virtually, or what they're going to call asynchronous. So you're learning at your own pace, logging in and logging out. So a couple of different types of options for you to choose. But again, they're all there for you on the PD Finder on the NY Works for Children website. So a great resource for you. And it also might be something to think about taking maybe some of those courses even as you're thinking about opening that childcare program, looking at behavior management, looking at speaking with staff members, looking at, family engagement. That also might be a way for you to think about how do you want to create your environments and how do you want to create your program to be the most responsive to both the children and the families that you'll be serving. There is also something known as ECETP. So we love the acronyms in early childhood education. So the Early Childhood Education and Training Program, ECETP, is funded through OCFS, and they have a library of different trainings, obviously that would all meet OCFS training requirements, again, on a wide variety of topics. You will be getting the link, I promise, in the follow-up email. I would strongly encourage you to do Aspire first, create your own individual Aspire account, then go to ECETP, because there's going to be a spot when you're creating your profile in ECETP that's going to ask you, do you have what they're going to say is a registry number? Yes, if you've created your Aspire registry ID number, you'll have one. Put it into ECETP. The two systems talk on the back end. That's my high-tech technology terminology. And so when you complete the courses in ECETP, it will automatically filter directly to your Aspire profile. So it's, again, helping to sort of minimize the up and down, download it, upload it, download it, upload it. It's already talking to each other. So I would strongly encourage you to create your Aspire profile first, then go to ECETP, take whatever trainings you want there. They'll all go directly to that. Also, if you're taking any of the trainings from the PD Finder, you're going to guarantee that they're also going to be put directly to your Aspire profile as well.
We do have a question. Does Aspire keep track of all my employees' coursework? I have looked for that and couldn't find it or how to set it up.
Yes, 100% they do. I'm going to just very, very quickly go to... I'm going to say it says resources. If you're in the organizational profile, one of the tabs is going to say resources. I could almost say it's resources. I can't think of the other word that it would potentially be. And when you click on that, there's a bunch of different reports that come up. And so I would expect it would be one of those reports. And I'm going to say courses, yes, would be in the individual staff members' profiles. But you would really want to see what the OCFS report would be. And that's what would show up in their resource folder. Okay. Any other questions so far? We're good. Okay. So create your Aspire account first. Go to ECETP. Put your Aspire number in there. That will transfer to you. The last one is also the child care resource centers. So many of them are also designed for supporting professionals in early childhood education. And so they often have a list of workshops that they are providing. And so again, I would highly encourage you to go back to your local child care resource or referral center, see what's on their website, apply for some of them. And if they are not Aspire registered and you're not going to get the certificate on the back end directly to your account, please, please, please make sure that you are getting a training certificate so that you are showing that you are meeting and counting towards your OCFS training areas. A couple of different things. Aspire NY Works for Children, I think we've covered that in great length. ECETP, again, has a wide breadth and knowledge of everything early childhood related. They've got some really nice courses that are there. Most people go there for the sort of new staffing, onboarding, minimal health and safety. I think there's about a 15-hour course that's there. And then I want to also talk a little bit about EIP. So that's called the Educational Incentive Program. And that is funding, money that you can apply to take courses, workshops, even college credits in early childhood education. Obviously, it has to be in early childhood education for it to be funded. You can, again, I promise the links are going to be there, but you can go to their website. You would create your own individual profile, and the benefit, the grant is based on your family size and income. So it could be completely funded, it could be partially funded, but that's another great resource to pay for some of the training for both yourself and your staff members, moving down the line. So it's a really nice resource for the early childhood field that not necessarily a lot of people take advantage of. I'm also going to say it is calendar year funding. So we are running out right now of those funds because we're coming up to the end of the year. The money will reset in January. And so if you are looking to take a course now in January, it will be denied because it's only for calendar year funding. So it's only for funding that's happening, or for training, that's happening in this calendar year. Okay. And then talking a little bit about communication practices. So we spoke earlier about the record keeping and the record keeping practices, and creating a system to make sure that you're maintaining lots of different records on lots of different things is also a really important part of running, and I'm going to say a successful childcare program. You are going to be monitored on a regular basis, especially as a brand new program coming out. when licensors, regulators are coming out, they need to physically see what's happening in the program. They are going to physically be checking records. And so we want to make sure that you have those record keeping systems there. An important part of the record keeping system is also having an effective communication system. So making sure that you have the ability to communicate with families, whether it is you caring for 3 children in your home or you're caring for 100 children in a child care center, you need to have a capacity and a system to communicate with families effectively, to make sure that you're passing along information, to make sure that you know what the child's needs are, wants are, all those kinds of different things. So thinking about creating a system for communicating with families, and then definitely communicating with staff. There is a lot of licensing requirements that take place. A lot of things have to do with staff members. You've got to have a way to disseminate that information with staff. And one of the things that we always have a sort of a concern and an issue with is we dedicate so much time to the children. We don't often have a lot of time for staff meetings and professional development days and those things. So again, things to consider as you're planning your child care program. Think about building in professional development days that you're giving staff members the opportunity to get a workshop, to go to a training, to bring a trainer into your particular program, or a day that they're there and able to meet with other colleagues and share some experiences around different professional development topics. Communicating with families. So when we talk about communicating with families, there are lots of different ways in which we do it. Most predominantly, I'm going to say specifically for the infants and toddlers, it's the in-person. I'm dropping off. Here's how their morning was. Here's how their afternoon was. It's those interactions that are taking place face to face every day, multiple times potentially a day, and so that's really critically important. I will say during COVID, there were some programs who sort of shifted and said, parents stay outside, we will take the children and we will bring them to the classrooms. But I do think the parents coming in and seeing the environment and seeing the classrooms and seeing the family homes supports that development of relationship. And you are developing a relationship with that parent just as much as you are developing a relationship with that child. Thinking about how will you share the information. I will say apps are a phenomenal technology has advanced and has really given us a great platform to share and communicate information. I am not at all endorsing one over the other. You will get a link to 2 different resources. One is a sort of a research paper that outlines and ranks the different childcare apps, and also outlines what each one of the different apps does. And so you'll get that as a resource. And then you'll also get basically a Google link to a Google search to about 20 different apps that are applicable to early childhood education. I definitely think those are great questions to ask. I definitely think those are things that you should start doing your research around now. And what I'm also going to say is start to think about, and how do you want to use that in your program? Making sure you're also capturing, as families are enrolling, what's the best way for me to get in touch with you. I literally don't have my phone in front of me, which is very unusual. Normally it's glued to my right hand. So some families prefer a phone call. Some families prefer a text message. Some families will say, just, speak to me at the end of the day. It all depends. Each family has a different preference. So I definitely think making that part of your enrollment information and getting to know that family and what their preferences are is only going to help strengthen those relationships that you have with the families. I would also say I would highly encourage you, even in a family childcare home, to have a family bulletin board where you're able to put up information and notices. It's, again, a great way for families to keep going and checking in. And I will also just add to that, make sure it changes, because if it looks the same from day one to the 700th day that they're there, they're going to turn a blind eye and they're not going to see it, and they're not going to understand the value of it. But I do think that's a nice way to also continue that conversation. So this is a small snapshot of the OCFS requirements regarding staffing. And so I am not reading these to you, but I want to highlight for you that communication with staff and having plans and policies and procedures and systems in place for staffing, You have got to start to think about that now. The only conversation that this is excluded to is that family child care provider. You are your own staff members. You are not developing a staff handbook for yourself. You are not developing policies and procedures to communicate with yourself. But for everybody else, you really are. And so I don't put this up there to scare you, but really to help really truly emphasize the need to think about these systems immediately as you are thinking about opening a child care program. These have got to be a part of the systems building that you're doing in your program development. Again, in one of the links that you're going to get, I'm going to share with you what's a link to what's called the Early Learning Resources Hub. There you would also go create your own individual account, your own personal account. And that has a lot of resources for you. They do sort of have it separated out for family or group family providers as well as for centers. There are also some school age resources that are there as well. But it gives you the opportunity to download literally handbooks, policies, procedures that you can come and take back and make your own. I would always encourage you to just take it and make it your own, not just download it from there and then start to hand it out. You want to make it your own. You want to tweak it. You want it to be your words and your language that's coming through to reference what you're talking about in your own program. These requirements, and you'll see the citations are there, are from OCFS Part 417. I did not go through, as I said, into each one of the different requirements, but this is just for family child care homes. So really, you've got to start to think about if you are engaging and employing staff, how will you communicate with them? What is the expectation that the staff members are having to communicate with family members as well? Are you giving staff members times to speak with other colleagues and to do maybe some shared planning and having different meetings around topics or professional development opportunities for them as well? So again, something to consider as you're getting into your building your staff. What will you share? How will you share it? When will you share it? These are all questions that come to my mind. And again, some of that is that systems building that you're going to need to do as you're moving forward. Some of that potentially can be done through some of those platforms. Staff members have access to those platforms as well, but also thinking about your onboarding, your hiring processes. How are you going to recruit and retain staff? And then are you going to be doing staff meetings? How often are you going to be doing staff meetings? Will you create a domain for emails so that those staff members are getting a work email, or are you expecting them to communicate on their own personal emails? Lots and lots and lots of things to consider as you're, again, starting your journey into creating a high quality, I'm going to say, childcare program. Oh, sorry. These were the requirements just for engaging with staff, with families. These are the requirements for staff. Excuse me. So this is from the Child Care Center. The licensing requirements before were from the family child care. So these are for 18. And so again, lots and lots and lots of requirements for how we're going to communicate with staff members. I think most of the time families are left out of that conversation, but I do think making your plan for how you're going to effectively retain staff and support ongoing professional development for the staff has got to be part of your consideration as you're opening a child care program as well. So we're going to talk a little bit about that business practice and sort of the structure of how do you want to design your program, a little bit about marketing and advertising, and again, coming back to that conversation regarding record keeping. So business practices. So first and foremost, I think you need to think of yourself as a business. This is no longer the day and age that we are a social service. This is a business that you are opening. We want you to be a thriving and successful business in that community for many, many years to come. We 1000% acknowledge and see early childhood education, childcare programming as a cornerstone of a healthy community. We know that that is a need out there in the community, and we want you, if you're opening that business, we want you to be a lasting business in that community for many, many years. In order to do that, you really need to have a sense of the type of business you want to be. If you are a group family childcare provider, you need to start to think about also, how are you protecting yourself and your home and your family versus your business? Because it's very cloudy sometimes when you are the provider in your own home environment. But you really do need to see that you're wearing two different hats, as the provider and as the mom or the dad or the person in the family. So thinking about, is it a sole proprietary? It could be a partnership, a corporation, S corp. All of these. This is so not my area of expertise, but this is a great opportunity to get to know the Small Business Development Center. It sounded like a lot of the people were in, I'm going to say, the Hudson Valley area. But if you're not, I will also make sure that the links that you get would include the SBDC overall, and they would be able to search it by their geographic location. So find the one that's closest to you. This SBDC is located in Rockland County. And so for those of you in the surrounding areas, Westchester has its own SBDC. That's you guys as well. Westchester and Putnam and Rockland are all with this SBDC. So that is a great conversation to have with somebody who is knowledgeable and informed about the different liabilities and risks that would take place in the different types of organizations that you have. The other thing I'm going to say more specifically for centers, are you looking to be a for-profit? Totally fine. That's it's people think that that's like a bad word in early childhood education. You actually can be a for-profit program in early childhood education. Or did you want to be a non-for-profit? And then that would open you up to potentially business grants and opportunities that you would be able to access, where you may not be able to necessarily access those if you were a for-profit organization. So I'm not going to get into a lot of that. I would highly encourage you to set up a meeting with an advisor at the Small Business Development Center and have a more greater in-depth conversation regarding that. I will get into a little bit in terms of budgeting and I think outlining what your expenses are going to be, what you are expecting your income to be. And then we'll talk a little bit about some nuances for family childcare. This has got to be part of your business conversation. We know the profit margin in early childhood is pretty narrow, especially if you're getting up and running. And so we want to make sure that you're getting right out of the gate prepared and hopefully able to be as successful as you possibly can. And so I think having a budget that outlines how you're going to be doing this work for the next umpteen years is really important. So income. Primarily, it's based on the tuition, the fees that you would be charging the families that you're serving. Now, that's potentially where the majority of your income is going to be coming from. You could also apply for or offer the families what we are going to call Child Care Assistance Program. CCAP is the new terminology for what was called Child Care Subsidy. And so very recently within New York State, the guidelines for the family size and income have been significantly expanded. So there's hopefully an opportunity to fund more families in child care subsidy. And that is not a requirement of your program. If you do not want to accept child care subsidy, child care assistance, you do not have to. Your income would be completely and totally from tuition, I would assume then. You can also apply for or partner with other child care programs in the area. I'm going to say specifically Head Start programs, early Head Start programs. Early Head Start programs serve children birth through 3. Head Start serves children from 3 to 5 years of age. And for the most part, there's a Head Start program in every county across the country. And so that's another opportunity potentially to be a child care partner to a Head Start program. They are serving the most needy families in terms of being the low income families, foster families, families experiencing homelessness. So if you're looking to serve that type of population and that's in your community, that might be a great conversation to have and reach out to your local Head Start association or your local Head Start program and find out a little bit more about that. That could be a source of income for you if you engage in this partnership. But not all programs are going to qualify for that. So for the most part, your income is going to be based on your tuition or the fees that you're going to provide families. I do also want to talk a little bit about childcare, the childcare and CACFP, the Child and Adult Food Care Program. And so the Child Care and Adult Food Program, Child and Adult Care Food Program, say it right, is a reimbursement to the expenses that you're already putting out. So if you are, again, in the planning process, thinking about providing food, it can be in a family or group family home, or it could be with a center. Are you asking the families to bring the child with the food that that child is going to eat all day long? Or are you providing the food that the child is going to eat while they're in care? Something to think about and consider. Again, if you're looking for a child care center, are you looking for a center that also has a kitchen in their space so that you have the capacity to do that? Or are you going to be contracting with somebody to cart that food in every single day, breakfast, lunch, snacks? CACFP is a reimbursement to the expenses that you're putting out regarding food. And so if you are providing food for the children in your care, then they would pay, you would enroll in their program. They would give you a reimbursement based on the meals and the number of children that you're serving. It does not cover the full course, cost of the meal, but it's a reimbursement to you. So it's helping to offset the cost and the food that you're putting out. Okay. Again, there will be a link. I want to speak a little bit about sort of how that program is administered. If you are a child care center, you would register with the local Department of Health in your county or city. And if you are a family or a group family provider, you would go back to your child care resource center. So that would be considered your sponsoring agency. That's the terminology that they use. And they would be the ones who are managing and monitoring and supporting your program in administering CACFP. Okay? So a little bit of a distinction if you're family or group family, and a separate thing if you're a center.
One of the questions from our virtual audience, to my knowledge, funding in Allegheny and Cattaraugus counties are not accepting new applications for the block grant. Are there any other funding opportunities until the funding sources are figured out? I'm a for-profit business.
So that is the case that we have heard in several counties across the state. And so, no, I do not know of any other subsidy pool of funding that's accessible for families. I would just say keep watching, because hopefully that they can put more money in those pots to get the wait list down and serve more families. But right now, no. And so those are not the only, Allegheny and Cattaraugus are not the only ones who are experiencing that. That is happening in several counties across the state. So expenses, we're going to sort of break that down a little bit. First, right off the bat, we know that there are going to definitely be some what we're going to call fixed expenses. If you are paying a mortgage, if you have a rent, if you're renting a facility, leasing a facility, we know what that's going to be every single solitary month. You can sort of count on that. For the most part, insurances, those kinds of things would be standard, a standard amount every month. You're going to also have some variable expenses. Things like your food costs. This month you're buying, less apples because you went on a field trip to the apple farm and you've got 10 bags for, $5, and now you've got an abundance of apples, so you don't need to buy that for the kids. So your food costs can be potentially lower this month than they would be, let's say, next month. Also, too, your classroom or your program supplies. Those also, again, something to consider. How do you want to do that? Do you want to give staff members an allocation every month? Do you want to give them an allocation once a year? If they decide to do a special, fall project, how do they get those materials and those kinds of things? Again, stuff for you to consider as you're thinking about opening that program. There's also, so those fixed and variables apply to everybody, right? It doesn't make a difference if you're a family, group family, or center-based program. You're still going to have all of those expenses. The amount of those expenses are going to significantly change, obviously, with the size and the number of children that you're serving. But the types of expenses are still going to remain the same. I want to have this conversation specifically to anybody who is looking for family or group family childcare. And so what we're going to talk about is this time, space, percentage. So I said earlier, you are in sort of a unique business model in the fact that you are providing business in your home. And I want to say it exactly that way, is you are providing business in your home. I work from my home. I don't count, I can't, and I don't apply to this time space percentage because I'm doing business in my home, but I'm not providing the business in my home. And so there is that bit of a distinction. The time space percentage, again, I'm going to defer it back to the Small Business Development Center to do the actual nuts and bolts and the actual number crunching around all this. But the higher level overview is you would look at the total square footage of your home, the total square footage of what's used in your home to support care. And I want to be very clear about that. So, for example, if you are cooking, your kitchen counts as that. If you're not cooking, your kitchen doesn't count. If you're potentially taking the laundry and washing the bedding for the children that they're sleeping in, that would count for space in your home. If you're taking a meeting at your kitchen table and you're doing all that professional development we spoke about online at your kitchen table, that counts. So any space in your home that you are using for or on childcare needs to be calculated. So there's all the space, okay? Then we look at the time. So we look at the actual amount of time you are physically open. Okay, again, something for you to consider. How long a day do you want to provide? And so I'm just going to make it super duper easy, and I'm just going to say you're going to be open from 9 to 5. Okay, great. So we know those hours. Now, what we also need to keep track of is all of the time you're spending on the program. So what I mean by that is, are you developing your lesson plans? Are you making an order for your food that you're having delivered? Are you writing out your checks for your staff members and calculating their hours and their salary and all that? Are you writing up policies and procedures? Are you doing professional development? Are you meeting OCFS requirements and submitting documentation that they need? All of those hours that you're working on your program now also need to be calculated. So we take basically all of the time spent working on and in the program and divide that out by the amount of square footage in the program. There's a lot of numbers involved. I'm giving you the high level overview. SBDC people will deal this with right down to the penny. I'm just giving the high level overview. And they will come up with a percentage. Typically speaking, it's between 30 and 40%. That 30 to 40% gets applied to every one of those shared expenses in your family home. And what I mean by that is, go back to that mortgage or the rent. Again, keeping the simple numbers. If that rent is $1,000 and you're now taking off 40% to go to your business, only 60% of that is to your family, 40% of that goes as part of your business expense, okay? So you have the capacity to do that as a family or a group family program. You do not obviously have the capacity to do that as a child care center. All of those are 100% business expenses because you've got a brick and mortar building that you're doing it. So it is a significant way to manage your budget and to really earmark a clear distinction between what's business and what's personal. And so a lot of people do not take advantage of that and are paying way too much in taxes because they're not taking advantage of that throughout the course of the year. So something to really start to think about and set forth as you're getting up and operational. You're not going to be able to necessarily come up with that time-space percentage until you're in your program doing the work. But that's something certainly to be tracking any time that you're working on your program. I would say and really highly encourage you to start to track that information now, because that's all time that you're going to calculate towards that time space percentage. Okay. And then marketing and advertising. So how will you recruit the staff? How will you recruit the families? Do you have a sense of where you want your program to be? How are you going to get that out there? I'm going to say, number one, once your program is licensed, you need to make sure you're contacting the Child Care Resource Center in your area. They are a resource and referral center. So families who are looking for care will typically go there. They are licensed and not licensed. They're going to give them a list of licensed and regulated programs that are out there. We want to make sure your information is there as well. Sometimes families do actually show up to the building. So if you've got a little flyer and you want to drop it off there, I would also encourage you to do that too. Word of mouth is great, but you don't have any word of mouth. So we can use that once you've got children up and running, but you've got to get those children in the seat before that word of mouth can actually happen, right? So thinking about doing what I'm going to call an environmental scan, I'm looking at creating it in here in Spark Hill. How many other programs are in Spark Hill? How many brick and mortar buildings are there? What are the ages that they're serving? What are they charging? What are their staff members' qualifications and experience? And then how many providers are there? Are there a lot of family providers? Is it saturated? I don't want to open up another home if there's a saturation in this environment as well. So thinking about getting to know and getting to have some of that data now is only going to make the program, I would say, better and stronger. And you might say, no, I'm not going to do it in this area because I can see that there's already need. But look at that, 4 miles away, there's nothing. Right. And so really thinking about geographically, are you going to be in a spot where families are going to be able to find you and access you? Okay. So thinking about doing that now and certainly knowing who is out there is going to make a significant difference for you as well. Once you've got the staff members enrolled and once you've got the families recruited and enrolled, I think that's where that, as I said, that word of mouth goes. But until you get to that point, it will, a lot of pounding the pavement. Social media is great. I will also say that's a conversation to have with the small business development team, that how can they support you with some of those marketing and resources around advertising your program. So record keeping, there are 2 tools that we'll talk about in a second. But when you're talking about record keeping, I want to make sure that you're aware that there's multiple levels of that record keeping that you're going to be responsible for. Certainly that programmatic kind of stuff. Obviously, OCFS is going to be managing and monitoring your program. They're going to want to see how you are in compliance with all of the requirements and regulations. Certainly the children's information, you're going to have physicals and their ages and their dates and their home addresses and all that kind of stuff. How are you managing all of this? Staff and then also the family's information. So a lot to think about and sort of be familiar with. 2 tools that potentially are a resource for you now as you're starting those systems are both the PAS, the Program Administrator Scale, and the BAS, the Business Administration Scale. The Program Administrator Scale, the green, is for childcare programs, centers, whereas the blue, the BAS, is for family or group family providers. So 2 different tools that speak to slightly different things. But what they're looking at is are there systems in place to ensure that high quality practices are going to happen throughout the lifetime of that program? I'm not suggesting that you're going to open the tool and meet these, these tools and meet them right out of the gate. However, it certainly is something for you to think about and be familiar with as you're opening your child care program. They can be a great resource for you. If like, oh, I never even thought about record keeping in that area, or I never thought about needing something in that particular area. And so it really could be a great resource for you to help think about or sort of shed light in an area that you may not already be familiar with. You can access those online. Again, there will be a link to the apps I spoke about before. But all of those things, you need to start bringing into that conversation also regarding your budget and thinking about how are you going to come up with your cost of care for the children. The more of these things that you have, the more potentially the cost of care is going to be. And so you also have to be able to temper that with, is that realistic in my community? And then talking a little bit about the environment. So whether it's the family childcare home or it's a center-based classroom environment, we want to make sure that there are sort of a few things that are taking place. And so absolutely at a bare minimum, having someone with an understanding in terms of early childhood development and making sure that whatever programming you're designing is developmentally appropriate is the terminology that we would use. The expectations that we have for the children are age appropriate. That's the best way to sort of define that. And then thinking about the indoor space. So when you're dealing with the licensing for family childcare and group family childcare, your indoor space, your square footage requirements really don't matter. It's going to matter the ages of the children is going to matter how many children you're going to be allowed to serve in that space. Okay. Whereas if it's a center-based program, the square footage of the room is going to determine how many children are going to be allowed to be in that space. So if you have, a massive room, that also does not mean that you're now going to be allowed to have 100 children in that space. I want to be very clear about that. So that's also something to think about is if you're looking at, I'm just going to say a large auditorium or a gymnasium, licensing will never license you for 100 children in that space. But they will say, it's got to be cordoned off in some way, whether you put up makeshift walls if you're able to, or you put in portable walls if you're able to. That space has to be broken down into smaller components where the children will be. And then they will say, 5 children are allowed in there, 8 children are allowed in there, 10 children are allowed in there in those individual spaces. Okay. And then getting to know the environmental rating scale. So we'll talk about that in a second as well. Outdoor space we're going to talk about. And then I will say the number one most cited concern is active supervision. People are entrusting you with their most precious thing in the entire world, and that is their children. And we do not take that for granted, and we do not take that lightly. And so really having a plan of how are you planning to supervise? And I'm going to say, irregardless of what position you're holding, how are you holding the staff members accountable to active supervision has got to be a paramount consideration in your thought process of opening a child care program, because that is absolutely the number one most cited violation for OCFS. We also really want to emphasize the interactions between the adults and the children, but the adults and the adults. Those relationships that we're cultivating with the families is just as critically important as the relationships that we're cultivating with the children, right? And it's through those relationships and that learning, that's where the learning is taking place. It's through those relationships. So we want to make sure that that's taking place. Thinking about, again, a daily schedule. I said it earlier, how long of a day are you going to be open, and what are you going to be doing with these children for 8 to 10 to 12, sometimes for 14 hours a day? Are you opening up a child care program that's going to be going 24 hours, that's providing alternate care, and you're going through the weekends or overnight in the evenings? You've got to have a plan for their daily schedule. Keeping the daily schedule consistent and those routines consistent is also really important as well. So something also to think about. I'm also going to go back and say the Early Learning Resource Hub that you'll get the link to. We'll have a lot of nice resources around that as well. And then finally, behavior management plan, thinking about that and coming up with policies, procedures, strategies, ideas of how you want to manage and handle that is also something to consider now as you're thinking about opening that child care program. So just to share a resource, you will get the link. I promise you're getting all these links. I really promise you're getting them. The Early Learning Guidelines is a great document we have here within New York State. It looks at the developmental milestones for young children birth through 8 years of age. A great, super easy read, easily accessible. You can get it online and download that. And if you really are not familiar with early child development at all, I would say that is a phenomenal resource for you. Nice, easy read to start to look at and think about, and you can take it one little section at a time. and start to use that in your thought processes, in your planning process as you're going through the licensing requirements. The indoor space. So we look at, and it's so funny. I want to go and grab the tools, but I won't come out of the shot. We do have a different set of tools depending upon the ages or the type of care that you're providing. So I just want to break them down. The blue book would be the ITERS. It's called the Infant Toddler Environmental Rating Scales. We then have the yellow, which is the ECHRS, the Early Childhood Environmental Rating Scale. The green, which is the FECHRS, the Family Childcare Environmental Rating Scale. You're getting this pattern, right, guys? And then we finally have the school age, which is the purple. So the school age childcare for those SAC programs, the school age care programs. Each of them, so the ITERS and the ECHRS are defined by ages. The ITERS, obviously, 0 to 3, so it's for the infants and toddlers. If in a child care program center, you have an infant or a toddler classroom, they would use that tool. If you have a center who has 3 through 5-year-old children, they would use the yellow tool. And if you are a family or a group family provider in your home, you would use the green tool. So the green tool takes into consideration those mixed ages of the children that you have. And then you're going to see a lot of that of not applicable. So are you serving infants? If you're not, it's not applicable. You're not penalized for it in any way, shape, or form, okay? And then the school age children are for children in a school age program from 5 through 12, okay? So a really great resource for you. I'm gonna say this is a great conversation and a great resource to think about as you're developing the daily schedule. It is going to outline the different activities or areas, centers that we would want to see the children engaging in throughout the course of the day. Do they have a significant amount of time in those spaces? And then what are some of the elements that make up a high quality space, okay? And so that's a really great resource for you in terms of the environmental rating scale. I'm also going to bring it back to your local childcare resource centers. They have staff members, I'm going to say for the most part. I can't speak about every 35 of the centers that are out there, but they are designed to have staff members on site locally who are familiar with the tool, who can also support you with it and walk you through using it, and whatever questions you might have around it. You can get these. I'm not endorsing them at all, just sharing a resource. The link will be in the guide when you get it. Kaplan is the organization who is eligible to contracted to sell the tools. So Kaplan Co. is the agency that you can get them from. I would also think you probably can go on Amazon and probably get them there as well. So be mindful of the ages that you're going to be serving and then get the appropriate tool, okay? As I said, the centers are square footage determined by the building. For the family child care, it's also the ages. I want to also just put a plug. It's not here on the slide, but I really want you to think about as you're designing your program, what are you going to be doing with these little ones all day long? And I would certainly hope it's not what we're doing here today, which is behind a screen. We want those children with hands-on activities, actively engaged, lots of interactions, lots of language. So please, think about that. And I'm also going to put in a little bit of a plug for family child care providers specifically. I'm going to say, I know you're doing an awful lot regarding purchasing from Amazon or maybe IKEA or Target or Walmart or those kinds of things. And I'm going to sort of try and have you shift your thinking to looking at more commercial grade products because you're going to be dealing with a number of children every day for a significant amount of time every day. The materials that you're buying for your own children or in those other places that I've already named are not quality consumer products that you're going to need for this age of child and for the amount of time the children will be engaging with it. So if I sort of just can plant a seed in that conversation, that's definitely going to change and impact your environment. So start to look at some of the companies that are out there for making purchases and investing in your program. That's also going to be part of your startup budget. And the outdoor space. I'm going to also say this. Children need to be outside every single solitary day, obviously weather permitting. We want to make sure that that is a part of your daily schedule and your routine. And so make sure that that's built into it. If you are looking at a space, you can certainly think about how are you investing in outdoor space outside. You can, if it's not there physically next to your program or your center, whatever, you can utilize a local park, but you need to get that cleared with OCFS and make sure that OCFS has that indicated on your license. Okay. And this is just, I hope, a little shot of lots of different outdoor activities and outdoor environments that you can potentially think about using and including as part of the space that you're offering in your program. I'm also going to put in my own little personal planting of a seed. Learning can take place outside and active play can take place inside. So, you know, there's that as well. I'm not going to get too much into what Lydia is going to be speaking about, but I do want to plant that seed for you there as well. I will say, you do not necessarily need to invest in a lot of heavy duty big equipment when you're dealing with outside play. Just thinking about portable materials and having an opportunity for the children to run and to move about. And then again, talking a little bit about that active supervision, we want to make sure that you are interacting with children and families throughout the day. There should be active engagement between the adults and the children that they're in care with. And we want to make sure that your daily schedule is reflective of the children's needs and their ages and abilities, and that they have the opportunity to freely explore, that it's a yes environment where they are, that they can freely create and move about and do what they need to do to grow and learn and develop. And then again, a behavior management plan. I will also put in, and I don't have it in the links, but I promise you I will add it to them. If you're not familiar with it, I would also encourage you to get familiar with the pyramid model. It is a resource we have here within New York State. You are able to access free training around supporting children's social and emotional development. And if you look on the Aspire website, that PD Finder, and you look for pyramid training, infants, toddlers, preschoolers, or family childcare, you would be able to find some there. But that would also help with your behavior management plan. OCFS is going to ask for that as part of your licensing requirements. So again, making sure that you have some consideration and time to think about how do you want that and what will you do when there's a challenging behavior, which we know are going to happen. So planning for it ahead of time is always going to be, a better thing to do than to be reactive. So I will share the links for the pyramid model. So that's a nice resource for you there as well. And then we're not going to get into the action planning now. That will be a document that you have. But I would sort of hope that for those of you that are there virtually, and certainly for anybody that's here, you're taking copious notes, and that they're really helping to sort of map out some of your next steps and what some of your action plan might very well be. I think that will help make the journey down the road to actually obtaining your license and your opening of your program a little bit more attainable and doable, and not so completely and totally overwhelming.
Thank you so much, Kathy. Sure. And at this time, we do have a special welcome and visiting speaker, so I'm going to allow him into the room now.
Luckily, we have a special guest here today. President Daly of St. Thomas Aquinas would like to say a few words.
Thanks, Lou. Just wanted to crash the party for a few minutes and say a quick hello. A topic that's certainly near and dear to my heart. Childcare is just so important and really a defining issue, particularly on folks' educational and career journeys. I'm a proud dad of 4 children of my own. I certainly remember the years when they were little and trying to figure out who's where, when. But more so now, proud president of 1,200 of our own students, including the educators of the educators. You'll hear from a moment from our new dean, Dean Prishker. We're delighted to have her in that role, but really want to ensure that our students understand their role in the broader community. So for St. Thomas Aquinas College now to host the SBDC, right here on campus, to me, that's the dream come true. A lot of college presidents talk about bringing the college out to the community. We love to bring the community here to the college so that we could work together and partner on solutions. So delighted to see that we're doing this. Real live example, I'm coming from speaking to a group of high school recruits. And as I walked in, I learned I was just the warm-up act. Daniel from the SBDC was speaking to the students as well, because the students are interested in business and finance and becoming entrepreneurs. And we talked about the careers, and I see Maureen and the team here today that we have right here on campus for our students. So we would love nothing more for our students as they're becoming educators to learn more about the role of childcare, how they can support it, and honestly getting such important technical information from someone who's an expert in the field, just so critical on our journey. So just want to say a quick hello, pop in, thank the SBDC for what you're doing for our community, thank our speakers today, but really just to reiterate that St. Thomas Aquinas College is so honored to host and partner with SBDC and showcase the best of our talent, as you'll hear shortly from Dr. Prishker.
At this time, we welcome Dr. Nydia Prishker. As President Daly has already shared, she is an esteemed member of the faculty here at St. Thomas Aquinas College and the dean in the education school. So thank you so much for being here, Dr. Prishker.
So I'm so glad to be here because, and so grateful to follow Kathy, right, with all her knowledge and how to open a business. But I want to really go a little bit deeper on what Kathy was just talking about the needs of the children, and to kind of, I guess, go and do some kind of mind shifting on what does it mean to have a childcare business. Understanding the children needs in childcare settings, whether you're beginning to explore this idea of opening up a business, or if you are already in the business, right, and looking to expand, we need to start this conversation about, what does it mean to have children under your care? More importantly, shifting that idea that maybe childcare is just babysitting, right, into this idea that we're supporting the education and development of children, right, together with the families. And that will really place your business into another place, right? When people start talking about your business and saying, you know what, that childcare center, that family childcare center has helped my child be school ready, right? So that is something that, will be a really nice marketing tool for your business too. So this idea of shifting the minds from babysitting to really supporting the development of children. So again, just as President Daly said, I am the dean of the School of Education, but my background really started in early childhood education and bilingual education. And, I'm also an assistant professor, and I lead those early childhood classes. So and these are my twin daughters right there. And one of our faculty members' son, he's there. And just an introduction, we're going to look at the difference between babysitting and early childhood education, and why childcare is about development and not just supervision, right? The role and the relationships that your job plays in making sure that children are not only safe, but they're also developing, right, under your care. I want to show you just this quick video, and I want you to think about, and I know for those of you on Zoom, I want you to think about, what do you see here? You have a baby right there, right, with a book. So this is just a simple but powerful moment, right, of what's happening in the minds of the children, right? So we have that responsibility as childcare providers to support that development and take that babbling and looking at the books into something else, and making sure that those things that are happening in the brain of that baby continue to develop, right? And then, making sure that they're ready for whenever they're in school, right? So think about what's happening. It's happening language development right there, right? The child is looking at a book and it's just trying to mimic what maybe the parents are doing to them. So you also, as a childcare provider, want to be that support for that child. So, as we just saw, children are, from the time that they arrive into the world, they're ready to learn, right? Children construct knowledge through play, through exploration, and from supports, right? Of, outside world, parents, family members, childcare providers. Every child is unique with different strengths, right? And we have to support that. And we have to also support and look at the cultural background, right? To make sure that we're also supporting that and expanding their knowledge based on what the children bring from home. That's important too. So securing those trusting relationships are essential, right? And thinking about how your business, your child care center, is the launch pad for lifelong learning and school readiness. So, as Kathy was mentioning, right, and that publication that she shared is so good. So I really encourage you to look for it once Kathy shares that link, to look at it and start kind of just like if you were flipping through a magazine, just start reading about child development, because you have to think about how are you going to support all of these domains in your childcare center, right? The physical, the cognitive, right? The language, the social emotional domain, and the cultural and linguistic development of the children. So when we think about physical development, think about motor skills, think about coordination, sensory development of your children. And children need both fine and gross motor skill development, right? Think about the activities that you're going to provide to your to the children under your care. Playing with water, exploring what happens when you put water on sand, little activities like that. So think about how you're going to support that development. Think about the cognitive development. How are you going to support the curiosity, encourage curiosity of the children with talking, with asking open-ended questions? And of course, maybe if you're carrying a baby just like the one that we watched, they're not going to answer you with full sentences, right? But as you're talking to the child, you're supporting that development as well. So it is important. That language it's important even when the babies are not talking, right? So responding to the babbles, responding to they're pointing at things, reading books out loud to them, labeling objects in your center, right? With pictures. So all of those things are important and when you have children under your care. And of course, so important, the social and emotional development of the children. Helping children understand their own feelings, that's important. Building those relationships and helping them regulate those emotions. And, having routines that really embed all of those things into your own schedule within the center. And of course, right, if you have children that are multilingual and coming from diverse backgrounds, making sure that you celebrate those things in your center. And how are you going to create the right environment? Let's talk about what makes an environment safe, right? Well, you have to look at your own organization, right? Making sure that the things that are that encourage children development are in, reachable for them. But the ones that are not helpful and they can be dangerous, they're not close to them and you have them, away from them. Have a warm and inclusive climate where every child feels that they belong. And of course, children learn through play. So make sure that you incorporate a lot of play whenever you have your the children with you. Because play is not only fun, right? It is also how children learn. And another thing that is super important is that, you have to communicate with parents to build that trust in that community, making sure that we understand that we're partners in this, right? That we are supporting the development of children as well as parents are supporting the development of the children. We both want them to succeed and to be ready for school whenever they leave our center. So communication is key, and that's something that Kathy also mentioned, right? How are you going to be communicating with your parents? Yes, it is great to have a system, email, text, and everything, but also build that relationship with the parents so you know what's happening at home and they know what's happening in the school, right? Because you never know. Maybe one day the child comes tired or it's crying. Maybe something happened at home and that you don't know, and you get frustrated because you don't know. But having that communication with a parent may open that door to say, I'm going to text the parent and see if something happened that I need to be aware. Maybe I'll give the child a little bit extra time during nap time or, think about those things. The flexibility of your routines too is important. So something that comes together from shifting our minds from the babysitting to a more professional educator role, we have to think about how we're supporting that, right? And one of the key things is being able to observe the children and observe their development, as we offer all of these different activities. Because as you observe the children, you're able to see, right, from one day to another, if you have a baby that's crawling, maybe from one day to another, the child's already standing, right? So you're looking at the development of their motor skills, right? Or, maybe one day the child comes and they're already saying a couple of words that they were not saying before. So how are you gonna, through observation, support that development and continue helping their growth? To plan experiences to support their growth. Now, going back to communications with the family, right? You want to communicate those milestones with the parents, right? So the parents are also supporting, then you both together are supporting the development of the children. So as you are observing, you're also reflecting on your practice and then adapting your strategies and your routines. If things are not working, then it is okay to change them, right? So one of the most important things for all of the children that are under our care, we have to really commit to equity and respect for every single child and every single family. Be aware of, what's happening outside of our childcare center too is important. So in closing, because I know we're getting ready to wrap up, childcare is early childhood education too, right? So we need to move away from just thinking about our business as, this place where parents are just going to drop off their children and we're just going to put them in front of the TV. Well, we cannot do that anymore, right? We have to plan and be aware of all of this development domains to be able to support that, right? So those resources that Kathy is going to share later with you, keep them close to you and read them, because those are important tools for you to understand how to support children, how to make your business better. So parents look for you because they know that you're going to make their children be ready for school, right? So again, when you think about that, right, think about how your place needs to be that safe space that builds relationship with families and give learning opportunities. You're shaping the future with every interaction with the children. So every child deserves to belong, learn, and thrive. So if there's no more questions, I want to thank you. And remember that the work that you do really matters. So thank you.
In order to keep things moving along, I'm going to invite Nicole Golden from the Lower Hudson Valley SBDC to come up. Nicole is going to present a little bit about the work that we do and how we can help businesses be successful.
Good morning, everyone. Like we just said, we are running short on time, so thanks for your patience. Before I begin, I just want to take a moment to give, again, a huge thank you to our presenters, Kathy Moss and Dr. Nydia Prishker, for sharing their expertise and insights with us today. This has been truly such an informative and engaging workshop, and it's been an absolute pleasure working alongside the both of them. So again, my name is Nicole Golden. I'm a business advisor here with the Lower Hudson Valley Small Business Development Center, and it is hosted here at St. Thomas Aquinas College. So I've personally been working with the SBDC for about 8 months now, and in that time, I've had the absolute privilege of working closely with a wide range of entrepreneurs. From those just starting out with an idea to established business owners looking to expand. It's been incredibly rewarding to watch our clients' businesses grow and thrive, and to see how the right guidance and support that me and my team provide can make all the difference. I also want to take a moment to, of course, recognize my team here that's in the room with me at the Lower Hudson Valley SBDC. Collaborating with them every single day, calling all of them all day if we're not all in person together. Learning from their experience, expertise really does ensure that the advising that I provide to my clients is always informed, thorough, and rooted in the best practices. It's truly a team effort here, and I really can't accentuate that enough. I'm very proud to be a part of such a dedicated group of professionals who share my mission of helping small businesses succeed. Now, again, to try to wrap this up, to close out today's session, I'd like to take just a few minutes to walk you through what we exactly do here at the SBDC and what that really means, and how we can help you if you're considering opening up your own childcare business or pursuing any entrepreneurial goal. So, to start, here's a little bit about who we are at the Small Business Development Center. The SBDC provides free, confidential business advising and support to small businesses and entrepreneurs at every stage of your journey. Whether you're just exploring an idea, getting ready to launch, or working to grow your business. We proudly serve the Lower Hudson Valley, which includes Westchester, Rockland, and Putnam counties. And at our core, our mission is just very simple: to empower businesses to launch, grow, and thrive while strengthening the local economy and building vibrant communities that surround us. We're here to be a trusted partner for you along the way, offering the guidance and resources you need to move forward with confidence. Now, let's talk about the specific services that we do offer. At the SBDC, we provide a full range of advising services, as you could see, and they are all designed to meet entrepreneurs where they are. Whether you're just getting started, scaling up, we always tailor our support to your goals. Some of the areas we help with include startup guidance, business financing and loan packaging, business expansion, business planning, digital strategy, legal business structures, operational efficiency, government contracting, and even certifications. And I could keep going forever because we cover so many things because everybody looks different. And we really do make sure that every piece of the puzzle always fits together for our clients. We can promise that the support we provide on all of these key areas are thoughtful, accurate, and always in the best interest of you. All the services we provide are designed, again, with that one goal in mind: to support entrepreneurs to succeed, and in turn, create stronger, more resilient communities. What truly sets the SBDC apart is our focus on impact, helping each entrepreneur move to action through guidance that's practical, personalized, and results-oriented. Each business is different, so our advising is never one size fits all. We take the time to understand your specific goals and challenges, then develop a tailored approach to help you reach the next stage of growth. Again, we are free, which is our biggest differentiator, I would say, in the field, but our no-cost services are designed to deliver real value, giving entrepreneurs access to expert insights, planning tools, and connections that could really make a measurable difference. Beyond one-on-one advising, we offer free workshops like you see today, training programs, and they're all designed, again, to strengthen your key business skills. We also provide data-driven research and market analysis, helping clients make informed decisions, which is backed by trends and reliable information through our research center. And because collaboration, of course, fuels success, we work closely with a very wide network of community partners, lenders, and industry organizations, ensuring that every single client has access to resources and relationships needed to build a strong foundation. So, if anything that you've heard here today, whether it was from Kathy, Nydia, myself, if it sparked an idea or inspired you to take that next step toward your business goals, I really do encourage you to work with us and sign up as an SBDC client. Getting started is very simple, and we will make sure of that. And once you're registered, we'll match you with one of our advisors who will help you with all of your business needs. You can reach out to us directly or visit our website to register, and we truly look forward to working with you and being a part of your entrepreneurial journey. So again, that concludes our How to Open Up a Childcare Business workshop, and thank you so much for joining us today and for your attention. And Lois is going to give some closing remarks. Thank you.
Okay. I want to thank all the presenters and St. Thomas Aquinas. I want to emphasize you've seen a lot, you've been presented a lot of information by a lot of experts, and this information and expertise is for you. It is for you to open up a child care center. So tap into our resources, join us online. You'll be assigned a counselor one-on-one, and we will provide you with the information and resources you need. Thank you very much. Bye.